Welcome. Thank you for choosing Catholic Medical Center for your upcoming cardiac procedure. We have produced this short video to help you better understand what to expect before, during, and after your procedure. After viewing the video, you will be contacted by one of our cardiac teaching nurses who will be glad to answer any of your questions that you might have. The heart is a hollow muscular organ which beats approximately 100,000 times per day. The right side of the heart receives unoxygenated blood from the body and pumps it to the lungs, where the blood receives fresh oxygen and is rid of its waste gases. The blood is then returned to the left side of the heart, and the heart pumps it to the entire body. The right and left sides of the heart pump simultaneously. The flow of the blood through the heart is regulated by the opening and closing of 4 heart valves. Problems serious enough to require surgical intervention usually occur in 2 of these valves, the mitral valve and the aortic valve. Both of these valves are on the left side of the heart. The mitral valve separates the upper and lower chambers on the left side of the heart, while the aortic valve regulates the blood flow out of the heart to the entire body. The first arteries to receive blood with each heartbeat are the coronary arteries. These arteries lie on the outside surface of the heart muscle itself. The right coronary artery feeds the right side and lower area of the heart. After a short segment called the left main, the left coronary artery splits into 2 branches, called the left anterior descending and the left circumflex arteries. The left anterior descending artery travels down the front wall of the heart, while the circumflex travels around to feed the back wall. These arteries then branch out to form a system of smaller vessels that supply the entire heart muscle with oxygen and nutrients. Coronary artery disease begins with a fatty streak and then buildup of fat in the artery wall. This leads to narrowing of the coronary arteries and reduces blood flow to the heart muscle. Symptoms of heart disease include chest discomfort, shortness of breath, fatigue. Other symptoms can be indigestion, nausea, vomiting, dizziness or fainting, and sweating. Some people experience all of these symptoms. Some people don't have any symptoms at all. Some people have their heart disease discovered on routine physical exam or testing. Most people, however, had some problem that led them to the discovery of heart disease and the need for surgery. Certain risk factors influence the development and progression of heart disease. These are in 2 categories: non-modifiable, or ones you can't change, and modifiable. The non-modifiable risk factors include age, gender, and family history. Your family history and your age may predispose you to the development of heart disease. Men usually develop heart disease at an earlier age than women. Men older than 45 and women over 55 are considered at equal risk. Modifiable risk factors are risk factors that you can help control your progression of heart disease. Smoking, high blood pressure, high cholesterol, and diabetes respond very well to medications, healthy diet, and weight management, as well as aerobic exercise. Being overweight and inactive or in chronic distress or stress will also contribute to the development of heart disease. Managing all of these risk factors after your surgery will help you to stay at your best possible outcome. Coronary artery bypass surgery is accomplished under general anesthesia. The surgeon exposes the heart through an incision in the breastbone. A graft is taken from another part of your body to build a bypass around the blockage. The most common graft sites are the saphenous vein in your leg and the radial artery in your arm and the internal mammary artery in your chest. With saphenous vein or radial artery grafts, the surgeon will make an incision in your leg or arm to remove that vein or artery that will be used as a graft. This then forms the bypass from your aorta to the coronary artery. The internal mammary artery feeds oxygenated blood to the chest wall. To use the internal mammary artery, the surgeon will remove the lower end from inside of the chest wall and attach it to below the blockage on your coronary artery. The number of grafts that you receive depends on your individual anatomy and may not correlate directly with the number of blockages that you have. After your surgery, your surgeon will tell you how many bypasses were needed to provide you the best possible outcome. Another common indication for cardiac surgery is diseased or defective heart valves. Heart valves operate like one-way gates. They open and allow blood flow through your heart and out to your body. They close to stop blood flow from flowing back into the heart after it has been expelled. The valves permit blood flow in one direction or pathway through your heart. The leaflets of a stenotic or calcified aortic valve are unable to open wide. Valves that are stenosed or stiff will restrict blood flow through the heart. Regurgitation occurs when a leaky or loose valve allows blood to flow back into the heart instead of out to the body. When these conditions start to produce symptoms or affect the function or structure of the heart, the valves will need to be repaired or replaced. Surgical intervention is primarily performed on the mitral and aortic valves. Defective valves can be restored to normal function by different surgical techniques. A valve can be supported by a surgical ring which is sewn in around your own valve. This is less invasive than a complete valve replacement and is frequently done to enhance valve function. A blood thinner may be necessary for a few months after your valve surgery. A mechanical valve is completely man-made and strong and durable valve. These valves will last your entire lifetime if cared for properly. They do require that a blood thinner be taken for the rest of your life and will need to be closely monitored by your physician. A tissue valve is made of tissue from an animal and is very well tolerated by the human body. These valves do not require the blood thinners to be taken and are often used by surgeons when there is need to limit the use of blood thinners. The decision about which valve surgery is best for you is something that you need to speak with your surgeon. Prior to your surgery, you will have several tests done to evaluate your overall health. The doctors and nurses caring for you will ask you for your complete medical history. Please stop any over-the-counter products that you may be taking, such as vitamins, herbal remedies, and nutritional supplements, and provide a list of products to your doctors and nurses. You will have various lab and radiological tests, as well as an EKG, pulmonary function tests, a carotid ultrasound, and a cardiac catheterization. Dental clearance will be required for valve surgery. These are all routine, preoperative tests to know as much about your medical condition as possible. The evening before and the morning of your surgery, you will be asked to shower with a special antibacterial soap. If you are at home, you will be given instructions on how to use this. We ask that you take nothing by mouth after midnight except for medications with a small sip of water. Please leave your jewelry and valuables at home to prevent their loss while in the hospital. Please remove all rings since post-operative swelling is common, and any rings will restrict circulation if left in place. The morning of your surgery, you'll be shaved from your neck to your ankles by a technician. After the shave, you will repeat your shower or bedside bath as your condition permits. You will be asked to rinse your mouth with a special mouthwash, and a member of the staff will swab the inside of your nose with a nasal antiseptic swab. All of these procedures are in place to help you prevent infection after surgery and will also aid in the comfort of your dressings and tape on your skin. You will receive a preoperative medication to help you relax before you leave the nursing floor. Most people are nervous prior to surgery, and this is helpful. Once in the operating room, an anesthesiologist will start an intravenous line and give you medication that will cause you to go to sleep. Your surgery will last several hours depending on the type of surgery you need. Discuss with your surgeon how long you can expect it to last. While you're in surgery, your family can wait in the ICU waiting room on level C. Your family may provide the ICU staff with their mobile phone number in order to reach them. When your surgery is complete, you will be transferred directly to the intensive care unit, and the surgeon will meet with your family in the family waiting room or contact them by phone if they are not in the hospital. The ICU nurse will allow your family to visit as soon as possible after your surgery. You may not remember them being there, but you will be aware of them at the time. Your family is encouraged to touch you and to talk to you. You will be covered with blankets and may be swollen from the surgery itself. Your skin may also be discolored from an antiseptic solution used in the operating room. This discoloration will fade over a few days. As you start to wake up, you will become aware of various monitoring lines and drainage tubes that were placed after you went to sleep. One of the monitoring lines will be in an artery in your wrist and will monitor your blood pressure continuously. You will also have an intravenous line placed in a large vein in your neck. This will allow for fluid and medication to be administered, as well as to monitor your heart function. You will have a temporary pacemaker wire connected to your heart, a special bladder drainage tube, and a chest tube as well. These special lines and tubes are placed while you are asleep. You will become aware of them once you are awake and have pain medication provided to you through the IV line for your comfort. After surgery is complete, the surgeon will close the breastbone back together with a combination of stainless steel wires and a titanium plate. These plates are screwed into the sternum or breastbone and allow the breastbone to heal better and decrease infection and decrease pain. The wires and plates are not removed and will stay with you for your lifetime. You will be given a card to carry in your wallet at time of discharge that signifies that you have this sternal plate. Your small leg incision will be closed using surgical glue and potentially covered with gauze. Your sternal incision will be held together primarily using a special sponge dressing known as a Prevna. This is attached to a small suction device that is similar in size to that of a cell phone. This dressing protects the incision as well as removes fluid and any potential infections. This will be removed before you go home. You will have a special breathing tube in place called an endotracheal or ET tube. During the operation, you will receive anesthesia gases through this tube. Once in the intensive care unit, it provides humidified oxygen from a ventilator. This tube passes into your trachea through your vocal cords so that you will not be able to speak. The nurse will have loosely tied your wrist to the side of the bed to prevent you from pulling on the tube while you're waking up. You should try to stay as relaxed as possible. A nurse will be with you and give you medication and keep you comfortable. Once your body clears the anesthesia, you will start to work with the ventilator. We try to take the endotracheal tube out as soon as possible, depending on your medical condition. Once it is removed, you will have an oxygen mask for a period of time, and then nasal oxygen for several days if necessary. You may find your throat is sore and voice is hoarse after the removal of the tube. This will quickly disappear. Many people do not remember having the endotracheal tube in place, so try not to worry about this if possible. Once your breathing tube is removed and you are stable, you will be transferred out of the intensive care unit. Your family will be allowed to visit with you more liberally, but you will still need a lot of rest. You will retain many of the tubes and lines you had in the intensive care unit, but will have a portable heart monitor to allow you to get up and move around while the nursing staff continues to monitor your heart rhythm. It is from this room that you will be discharged home. It is important to exercise your legs while you are resting in bed to prevent blood clots from forming. Bending your legs or pushing with your feet as if you were pushing on a gas pedal in the car are good ways to increase circulation and help prevent complications. You will also be given some special stockings to help reduce swelling of the lower legs. You will be assisted out of bed after your surgery as early as possible. The nursing staff will help you sit on the edge of the bed and then in the chair for your meals and walk in the hallway. The earlier you get moving and the more often you move, the better it is for you. Please remember to take your pain medication to assist you with your recovery. Many patients are ready for discharge home in less than a week of their surgery. Prior to your discharge home, you and your family will be asked to attend a cardiac discharge class with a cardiac teaching nurse to review basic guidelines for recovery. We will review normal and abnormal healing, activity guidelines, and how and when to call the doctor. The physical therapy department will review your home walking program prior to being discharged. Walking is the best exercise in your early recovery period and will help you to slowly regain your strength and endurance. A registered dietitian will also review a heart-healthy diet with you before you go home. Many people are not hungry at first, and food does not taste good to them. The dietitian can help you find the right foods for your proper healing. Depending on your medical condition, you may receive instructions from other healthcare providers prior to your discharge. After you are medically cleared by your surgeon, you are strongly encouraged to participate in a cardiac rehabilitation program. Cardiac rehab is a monitored exercise and education program that is structured to help maximize your recovery from heart surgery and prevent further problems. We will provide you with a list of regional programs available and discuss this with your cardiologist and primary care provider. We hope that this video has been helpful to you and helps you understand your upcoming cardiac procedure, and we wish you all the best of luck, and we'll see you after surgery.